A 57-year-old man with severe pneumonia and hypoxemic respiratory failure. Definition of pneumonia. Inflammation of one or both lungs with disease area of lung inflammation. Pneumonia is frequently but not always due to infection. The infection may be bacterial, viral, fungal, or parasitic. Symptoms may include fever, chills, cough with sputum production, chest pain, and shortness of breath.
Pneumonia is a common infection of the lungs affecting mostly the microscopic air sacs, the alveoli. The function of the respiratory system is to exchange oxygen and carbon dioxide between the body and the environment. This process takes place in the alveoli of the lungs. Inhaled oxygen moves from the alveoli into the blood in the capillaries, while carbon dioxide relocates from the blood to the alveoli to be exhaled out of the body. In people with pneumonia, these air sacs are filled with fluid or pus, hindering the gas exchange process, resulting in difficulty breathing and a cough reflex. Other symptoms may include chest pain, fever, chills, and confusion. Pneumonia is not a single disease. A large number of various organisms can cause pneumonia. Bacterial pneumonia is the most common, with Streptococcus pneumoniae being the main culprit. Viral pneumonia is more common in young children. A variety of viruses are implicated, with each of them predominating in different times of the year. Pneumonia commonly starts as an infection of the upper respiratory tract, a cold or flu, which then spreads to the lungs. The most common routes of transmission are through inhalation of contaminated aerosol droplets and aspiration of oral bacteria into the lungs. The setting in which pneumonia develops is important information as it helps to identify the source of the causative agent and hence the treatment approach. Generally, community-acquired pneumonia is less dangerous than healthcare-associated, hospital-acquired, or ventilator-associated pneumonia. This is because an infection contracted outside healthcare facilities is less likely to involve multi-drug-resistant bacteria. Patients who are already in hospitals are more likely to have other health problems and weakened immune system, and are thus less able to fight the disease. Pneumonia is often diagnosed based on physical exams and a chest X-ray. Clinical assessment for children is primarily based on a rapid respiratory rate, a cough, presence of lower chest wall and drawing, and the level of consciousness. Adults are usually checked for vital signs and presence of chest crackles. Bacterial pneumonia is treated with antibiotics. The choice of antibiotics depends on the patient's age, health conditions, and how the infection was acquired. Viral pneumonia caused by influenza viruses may be treated with antiviral drugs. Hospitalization may be required for severe cases with breathing difficulty, especially for young children, the elderly, and those with other health problems.
Applications in medicine treatment. At first, ceftriaxone and azithromycin were administered intravenously. Azithromycin and an albuterol inhaler were prescribed, and the patient was discharged home. 2 days after 11 days before this admission, the patient called his physician because of persistent symptoms. Prednisone and cough syrup were prescribed. Vancomycin therapy was initiated on the 3rd day at the other hospital, and imipenem therapy was initiated on the 5th day. Pros and cons of the treatment. Pros. Albuterol is not indicated in the treatment of pneumonia unless the patient also has asthma. If this is the case, then the albuterol is being used to treat the asthma and not the pneumonia. Cons. Increased risk of such cardiovascular events as myocardial infarction, heart failure, and cardiac arrhythmias.
Hello and welcome. In this video, we are going to talk about pneumonia. Pneumonia comes from cough, fever, shaking chills, and shortness of breath. Don't you worry, try these simple remedies at home for some relief. Take a glass of water, add a teaspoon of fenugreek seeds to it, boil this mixture, strain this, and drink this fenugreek tea 4 times a day. Take a teaspoon of flax seeds or linseed. Take a teaspoon of sesame seeds. Put these two together and bring to a boil. Once the water is boiled, strain it. Add a teaspoon of salt and a teaspoon of honey. Mix this well and drink this every day. Take 3 parts of carrot juice. Add 1 part of cucumber juice to it and 1 part of beetroot juice. Drink this once daily. Thanks for watching. Hope this video helped you.
Issue applied in Ecuador. Between 2003 and 2013, the common cause of mortality in our country was pneumonia. This disease caused the death of many people.
Stay warm this winter, for pneumonia kills 4 million people every year. Here's what you need to know to survive. Which of the following comedians died from pneumonia-induced complications? Was it A. John Belushi, B. Bernie Mac, or C. George Carlin? Pneumonia is an inflammatory condition of the lung caused by infection with viruses and bacteria. It affects microscopic air sacs known as alveoli. Those infected with the disease often experience severe cough, fever, shortness of breath, increased heart rate, and sharp or stabbing chest pains during deep breaths. Pneumonia can infect you wherever you may be, even in your daily life, such as at school or work. This is due to the fact that it's caused by breathing germs into your lungs. You're more likely to get the disease after having a cold or the flu because these illnesses make it harder for your lungs to fight infection. When you're infected with pneumonia, a collection of fluid forms in the alveoli, or the space surrounding your lungs. This causes an inflammation in the surrounding lung tissue. The swelling causes the alveoli to become less elastic, making it harder for oxygen to get through. So in essence, pneumonia causes you to drown to death from the buildup of fluid in your lungs. In most cases of pneumonia, a combination of antibiotics, rest, and fluids suffice in treating the infection. More severe cases may require hospitalization, where oxygen therapy and other breathing treatments will be administered. Another method of treatment for extreme cases is through pleural tap or tube thoracotomy, in which a needle or tube is inserted through the chest wall in order to drain the fluid buildup in the lungs. So which of the following comedians died from pneumonia-induced complications? If you guessed B, you're right. On August 9, 2008, Bernie Mac died from sarcoid.
Conclusion. This disease is increasing every year in our country, and although there has been a lot of campaigns to prevent it, our population keeps getting sick for this disease.
According to the American Lung Association, pneumonia kills 40 to 70,000 Americans each year. More than 1 million Americans are hospitalized every year from pneumonia, making it the third most frequent reason for hospitalization next to birth and heart disease. For recurrent pneumonia patients, it is important to recognize the symptoms: coughing, chest pain, difficulty breathing, high fever, and nausea. Early detection by your doctor can help prevent severe cases. Your diagnosis will begin with a brief medical history. It is important to be thorough, including past family history, smoking, hospitalization, and surgical history. A physical examination will help to understand abnormal lung activity, identified by bubbling, crackling, or rumbling sounds. Chest x-rays can confirm the presence of pneumonia in the lower lobes of the lungs. Air is black while pneumonia appears as white clouds. Proper diet is important to prevent malnutrition during the recovery process. Be sure you are getting a high-calorie, high-protein diet. Vitamins and minerals to strengthen your immune system, fruits and vegetables, as well as 1.5 to 2 liters of fluids daily. Activity is also important for preventing pneumonia. Walking 15 minutes per day or as tolerated can help condition your lungs. Another way to condition your lungs is to use the incentive spirometer. The medical device is very effective, but proper technique is the key. The first reaction for most patients is to blow into the spirometer, but this is improper technique. The proper use of the incentive spirometer is to first seal your lips tightly around the mouthpiece. Next, draw your breath in slowly and deeply. Note your highest level. Finally, hold your breath for at least 3 seconds and exhale normally. Repeat this exercise 5 to 10 times and follow with a deep cough. This mobilizes secretions and fully expands the lungs. Preventing recurrent pneumonia is equally as important as treatment. Avoid smoking. Be sure to receive flu and pneumonia shots as advised by your doctor. Avoid people with a cold or the flu. And follow proper hand washing steps. Apply soap to your hands under running water. Rub your hands together to create a lather for 20 seconds. Rinse your hands well and use a clean towel or air to dry.